Hi, everybody. Thank you so much for joining our webinar tonight. I'm Sydney, our Center Director here at the Brain Balance of Allen. I also have our Parent Coordinator, Mimi, joining me. She did just have a phone call at the front, so she did hop off for just a second. We are going to get started here in just a few moments as soon as Mimi is ready. This webinar is being recorded. So everybody will get a link to the recorded version at the end of the webinar, about 45 minutes to an hour after we finish up tonight. I'd also like everybody to know that we are going to have a Q&A towards the end of the presentation. If anytime during the webinar you guys have a question, please send that privately to our Parent Coordinator, Mimi Lee. She is listed on the participants. And then at the end of the webinar, we'll go ahead and read those out one by one and answer those as we go through it. Awesome, guys. So let's go ahead and get started. So I already mentioned my name is Sydney. I am the Center Director here at the Brain Balance of Allen. I have been with Brain Balance now close to 4 years. I have a background in kinesiology and occupational therapy. I've worked with kids in foster care settings. I've worked with kids in school settings. And then obviously here at Brain Balance, we're working with kiddos ages 4, and I say kiddos, but we go up to age 24 as well, so also young adults. Mimi, are you ready to introduce yourself? And I think she might still be on a call, so I'll go ahead and introduce Mimi, and then she'll share her video again here in a second. Mimi has been with us at the Brain Balance of Allen for closer to 5 years now. She started off as a coach, she was a receptionist, and now she's moved up to a director role where she is our parent coordinator. Her background is more speech pathology, so she has a lot of information on that and brings a very unique perspective to our center. So we definitely love having her here. Our program director, Brian Martin, is also going to be joining us here shortly. He was wrapping up with the family and center. So we're excited to invite Brian on. This will be his first time joining one of our webinars. So that's tonight. And I do ask that everybody mutes themselves just so we can go through everything and there's no background noise. Thank you so much, guys. So I want to start off tonight just talking about some of the statistics around anxiety. It can occur in kiddos as young as 6 years old. It affects 25.1% of children from ages 13 all the way up to 18. And we know it affects adults too, but we really want to focus on those younger ages through this webinar. It also leads to significant impairment in academic, social, and family functioning. And that can really, really cause issues in a lot of different environments for not only you guys as parents, but also watching your kiddo struggle with some of those areas. Mimi, I see that you're back on. I went ahead and introduced you shortly, but if you wanted to add anything as we jump into the webinar, feel free, okay?
Yeah, sure, definitely sounds good. Let's do it.
So children with anxiety are at a higher risk to perform poorly in school. They tend to miss out on important social experiences like hanging out with friends, enjoying sports, because they start having those repetitive thoughts and they have a hard time shutting that off. And we're going to talk about some of those areas in a minute. They also have a greater risk for drug and alcohol problems in their teen and young adult years. And this is where they start figuring out, how do I cope with these feelings? That's very hard, slippery slope to go down. And we often see our young adults who come into our center struggling with these issues, and it all starts early on. So what does it look like? What does anxiety look like? Anxiety in a classroom, and that's kind of where I want to start off, can look like poor test performances, can look like test anxiety. It can look like a student who is constantly worried about what others think of them. It can be a student who's stuck on a repetitive thought. I need to erase this paper. I need to get my G just perfect. It can be a kiddo who gets stressed out by timers. When that thought of, I only have 25 minutes or 30 minutes to complete this assignment, completely shuts them down. It can look like a kiddo that is worried and concerned about assignments stacking on top of each other. And it's just that never-ending doom of, I'm never going to get through this. I have a project due, and now I have math work on top of it. All of these pieces start to impact schoolwork, but it doesn't stop there. Our kiddos take that home with them, and then it starts affecting their relationships with siblings or with their parents and guardians. It affects their sleep cycles. It affects our health. It affects our digestion, our sense of self, and our self-confidence. Anxiety is really one of those struggles that impacts children and adults as well across all areas of their life. And it doesn't typically just inhibit one area as it would at school. It's across a multitude of life environments. And that's where we jump into, when do we start worrying? And I really like that saying, everybody worries sometimes. We do. That's a normal response. But when do we need to be worried about how much our student is worrying? And here's the thing, all of those things that I just listed previously, those are normal to worry about. We should worry about how long we have to complete a task. Those small stressors keep us focused and goal-oriented. But when we find that the worry is no longer logical, when we can't calm those fears, when it starts to really interfere and we see more of that avoidance instead of stepping up to a task, that's when we really want to start being concerned about these areas. When the worry is impacting schoolwork, friends, relationships, and ultimately enjoyment of activities. If we start to see those concerns with testing, and there's a test on Friday and your kiddo is obsessed and focused on it on Monday and can't stop worrying about it the entire week, where they start missing out on other areas, that's when we want to start being concerned. And I want to kind of back us up a little bit. I was talking to Mimi about this as we were kind of pulling this presentation together. Whether or not we understand or we can relate to this worry that our student or our friend or whoever else is experiencing, it's very real to them. It's very real. And I was talking to Mimi and I kind of mentioned, if I stub my toe and Mimi sits there and tells me, I just saw you stub your toe, but it's fine. You're fine. It doesn't hurt.
Yeah, you're fine. Just dismissing it.
I'm going to be mad. I'm going to be mad that she's not taking me at face value when I'm telling her this hurts. I know that it hurts. I know that it's bothering me, and somebody else is downplaying that emotion and that feeling. So one thing I do want to start off this presentation just talking about is we should always avoid vocalizing that this isn't real or that this isn't as bad as they're making it out to be, just because we can't see it or we can't feel it. And I also want to mention that when we're looking at kids, majority of the time, and I do say majority because I've seen some very intuitive kids, especially at our center, but majority of the time, our kiddos aren't going to say, you know what, Mom, I woke up this morning and I'm very anxious. That rarely ever happens. But what they are going to say is, I have a headache. I can't go to school today. I don't think I want to go today. My stomach hurts. And they start to say, I just don't feel good. Or maybe they start asking, well, what are we going to do when we get there? Are we almost there yet? Those repetitive questions, wanting just to feel reassured. And it's not the occasional. I'm talking more about you're noticing this on a daily or a weekly basis. Those are some of the signs that we do want to pay attention to, because a lot of our kiddos don't have the words to express how they're feeling. And so we want to pick up on those key phrases. Anything you want to add to that, Mimi?
No, I think you explained it really well. Yes, I agree that we shouldn't dismiss any of our kids, like whatever they're thinking or they're feeling or they're saying. I think, whatever they're feeling really is validation. But how are we going to help them through those chaotic thoughts and process? That's kind of like what we're trying to get at. And how do we handle that anxiety?
And that's spot on. And that actually takes us right into, so what are we going over today? And I want to preface that with, we're not here to diagnose, nor to treat anxiety truly. And I do want to say, if you as a parent or a guardian are really worried or concerned and you're not already working with a mental health or a medical professional, please feel free to touch base with me or with Mimi after this presentation. And I would love to refer you to a medical provider or to a counselor to ensure that all aspects of anxiety are being addressed, because anxiety is very, very complex. And it's also a sensitive subject for a lot of people. And I just want to kind of say, here at the Brain Balance of Alan today on this presentation, we're here to share one perspective. And this perspective is based off of the experience that we have, and as well as our backgrounds working here at Brain Balance and also working with development in children. But once again, I cannot emphasize this enough. Anxiety is very complex, it is very real, and if it's not addressed appropriately, it can snowball into very detrimental situations. And I typically encourage families in our center that are struggling with anxiety to parallel our program with a counselor or with a therapist, because as we look at some of these processing pieces and developmental areas that are very important when we're looking at anxiety, we also want to make sure that we're processing things appropriately and we're incorporating other domains to help with those skills. So overall, our biggest goals for today, why do some kids and young adults, why are they more prone to stress or to anxiety than others? We want to explain how development can have an impact on stress and anxiety. And we also want you guys to be able to take away tips and strategies that are going to complement traditional services. So I am going to be sending out an email with the recording to this webinar, but also to just some tips and guides that we're going to briefly talk about and towards the end of this webinar. So you guys will have that hands-on piece to go over tonight. So let's go ahead and jump into some of these developmental pieces. I mentioned it earlier, anxiety is very complex, it's very complicated, has a lot of different factors, and it has a lot of nuances involved that are very specific to that person. What Mimi experiences with anxiety is going to be very different than what I experience with it. But I do want to say that this anxiety that we're focused on as far as the developmental pieces, this is not PTSD anxiety, this is not trauma, or really any anxiety that can be related to an unsafe or an unstable environment. Today is really about how development can impact anxiety, and more specifically, how gaps in development begin inhibiting function that then cause an increase in anxiety, and most importantly, how we break that cycle, and how do we start increasing development, increasing function, so that we see the decrease in anxiety. So as you can see with this iceberg model, all of the symptoms at the very top: excessive worry, avoids groups, activities, and friends, nail biting, hair pulling, stomach aches, crying before school, refuses to go to school, going back to some of those headaches, the nausea, the vomiting, all of those are physical things that we're seeing. We're watching our student go through those symptoms. But there's a lot going on underneath that we're not always aware of, and that can impact the brain development. The brain begins to develop in utero, and when a baby's born, they have what we call primitive reflexes. And these are survival skills that, once again, we all have through infancy. So by the time we're hitting that year marker, these should shut off, and they're going to allow our higher level skills to start taking over. One of these reflexes that is very important when we look at anxiety is called the Moreau reflex. And I know Mimi's going to jump in a few minutes and talk more about that. But this is really when a baby hears a loud noise, it startles. Heart rate increases, their breathing increases. It's this protective mechanism where the function of our downstairs brain, which is processing everything through our emotions, versus our upstairs brain, which processes through more reasoning skills. It's really those two differences. have you ever had your child, and I typically call this a greater than reaction. Have you ever had your kiddo where it's something very, very small? Maybe they spill a cup of water and they have a greater than reaction. They have a meltdown over it. This can be a sign and sometimes a symptom of your child potentially having some primitive reflexes retained or still left on. So this is going to be that foundational piece. It's at the very, very bottom of that iceberg. Next area we start to look at when we think about brain development is, what does it need to develop? How do we drive forward development in our brains? And the answer to that is sensory stimulation. Oftentimes children with anxiety can have heightened senses because the area of the brain that should modulate these senses and the sensory input tends to be underdeveloped. So at Brain Balance, this is what we're really looking at, and this is what we start to assess. How does your student hear? How do they see? How do they smell? How do they feel? How do they process all of those pieces? And then we want to start thinking about how a baby lifts up their head, how they roll over, how they sit up, how they begin to walk. All of those motor milestones are essential for brain development, secondary to the senses. However, the motor development piece, it doesn't just stop initially. We continue developing. We continue driving forward motor movements to more sophisticated skills. And as the brain becomes more developed, we want to see these skills become more developed. And that's where we start to see higher levels of emotional regulation, thought process, inhibition response, all of those pieces come forward. But it all starts with that foundational piece. How is our brain developing? The next slide, I just want to briefly kind of go over. This was actually taken from a 2014 lecture. I believe it was at Stanford. Dr. Tom came forward and said, our goal going forward is transforming treatment and getting it to be less about serotonin and more about driving circuitry. And I just love that statement. When we break down the way that science has been going, the way that research has been developing, we are at such an awesome time as far as science, as far as healthcare. We used to look at everything very, very isolated and very one-dimensional. And what I mean by that is it used to be anatomy, neurology, psychology, immunology, everything was so isolated and separate. But everything is really starting to become neuro-based. So we have more people doing neuropsychology, neuroendocrinology, neuroimmunology, bringing all of those pieces back together, because at the end of the day, we cannot separate how our brain is functioning or what's going on in our brain and our mental health from the rest of our body. It's all intertwined, it's all connected, and it all feeds back to how our brain has developed. We have our two hemispheres in our brain, our left hemisphere and our right hemisphere. And each hemisphere has complementary functions. Our left brain, I typically call our gas pedal, and our right brain, I typically call our brake pedal. So our left hemisphere, this is our gas. This tends to be our thinking brain, our pattern brain. It's really where we have that ability to recall facts and details. Whereas our right brain, I typically think of this as our regulation piece, our ability to stop and think before we act on something, our reasoning brain, our spontaneous brain, social skills. However, we need both of those working together. We need these to be very connected to have those well-rounded skills. So kind of what we're looking at on this slide is when we have that perfect communication, when we have that perfect balance, we have a teachable brain. We have a brain that's not struggling with some of those anxiety pieces because it's not getting overwhelmed as easily. It's processing the senses, it's processing the world around us appropriately. So then the question becomes, what happens when we don't have that balance? We end up having overdevelopments and underdevelopments in the brain. And oftentimes children with anxiety, their left brain starts going 90 miles a minute. And they're thinking, and they're thinking, and they're thinking, but they don't have that regulation piece. And so they don't have that part of the brain that says, okay, this is no longer logical. We're gonna be fine. Let's calm down and let's work through this. They just have that piece that says, but what if, but what if, but what if? So our predictor brain gets turned on high, and they want to know what's going to happen. They need that repetition because they feel safe in repetition. And so when that right hemisphere has that underdeveloped side, they're just struggling with turning off that gas, and they have a hard time seeing that big picture. They can also struggle with being able to read facial expressions. They can struggle with fitting into social environments and feeling comfortable with those. So the bottom line of all that is, if you have areas of the brain that are overdeveloped and then you have areas of the brain that are underdeveloped, it's as if you have one side processing on Wi-Fi and the other side processing on like a dial-up connection. They're not communicating effectively. One is super high speed and one is really slow, and that causes a huge disconnect. So we have the skills to worry in that case, but we don't have the skills to regulate and to shut down that worry when it's no longer logical. So I also want to go over what are those specific pieces that tend to make some children or some adults just more susceptible to having that imbalance, to having that gas pedal floored and not having that regulatory piece. One of the ones I mentioned earlier is that startle, or often called the Moreau infant reflex, still retained. And I kind of mentioned earlier, Mimi's going to talk more about this one in a minute, but our startle reflex should no longer be present by the time we're a year old. This should be fully integrated. Another area that can affect this is the ability to perceive our body position and our movement. If we're not processing the world around us, we're going to have a hard time reacting to the world around us. Our body coordination and our timing, our development of our sympathetic and our parasympathetic nervous system, and also our ability to inhibit our actions or our thoughts. And I touched on a few of these as we're going through development, and I did see that Brian joined us. Mimi and Brian are going to jump in and just break these down a little bit farther.
Yes. So this is Brian. He's our program director here. He just hopped out of a meeting, so he's here to join us for our anxiety webinar. So one of the elements of development that impacts anxiety would be, one of them is our startle reflex, or sometimes called the Moreau reflex. It's a survival skill that's developed in utero. So during pregnancy and by the time you're a year old, this reflex should no longer be present. This reflex gives way to higher level skills and emotional regulation once it integrates or shuts off. So when it doesn't shut off, we see a hypersensitive fight or flight response that gets triggered by noises, touch, or anything that's unexpected and can startle a child.
Definitely. And the biggest piece with our program is when we're looking at some of these primitive reflexes, because there are more than just the startle Moreau reflex. The biggest goal is, if this is still turned on and we do have that hypersensitive fight or flight, our goal is actively integrating this, actively going about setting up very specific motor patterns and connections and exercises that are going to get this shut off so that we can take those next steps into development.
And then another element of development that impacts anxiety, anxiety is our ability to perceive our body movement, our body position. Being aware of our body is really important. It helps us have an accurate perception of motion and movement. It allows you to process and predict what may happen around you. And it helps you perceive not only how you look, but also how you move, how you're acting. And it helps you pick up on signals and cues that are happening all around you in your environment.
And I think one of the biggest pieces, and I kind of mentioned this earlier, is if we're not processing how other people's actions and how our own actions are moving through our world, we're not responding accurately. And that goes back to some of those pieces of development. If we have delays or gaps with some of these functions, it's getting harder and harder for our body and our brain to make sense of what we should do. And that starts triggering that, well, what do I do here? What do I do here? Those repetitive questions, that repetitive thought process.
As well as the startle reflex and the ability to perceive our body with movement and motion. We also need body coordination and timing. Research has actually shown a direct connection between our cerebellum, which is the part of our brain responsible for coordinating voluntary movements, which we use in our everyday lives. So we need to have the ability to coordinate body movements in coordination and timing, reacting with the appropriate timing, which helps give you that control. So much of what we do in life is really based on our past experiences, and that helps us predict what is going to happen next in our just every day.
Definitely.
And then there's that ability to inhibit our thoughts or actions. So inhibition requires a high level of development. So if you don't have that, you're probably going to be doing something irresponsible or rash. So you can't inhibit what you haven't developed or can't control. So, you see kids that are singing and dancing out loud, just having no care in the world. And as they mature, they become aware of how they're being perceived, and then they begin to inhibit their actions. So it takes a very high level of ability to stop, to control, and then to move beyond that moment. And less of an ability to be able to stop those actions and thoughts and behavior can be a red flag in areas of immaturity and development.
And I think, I'm kind of going to speak for Mimi and Brian, we typically have parents who come into our center, and one of their biggest concerns is impulse control. Mm-hmm. And just as Mimi was saying, you can't inhibit what you haven't developed. You can't control what you truly don't have the skill for yet. And so that is a part of our process where we have to break down those steps, and we have to say, okay, if impulse control, if inhibiting those thoughts and those actions is truly the biggest goal, we have to break those steps down and then have a clear plan of action of how do we reach the top of that iceberg? How do we address all the underlying areas, which is why we're having impulse control struggles, or why we're stuck in those anxious thoughts? We have to break it down, get to the root of that. And that's exactly what we're looking at here is the inhibition of thought and actions. That's the oversight. We want to break it down. We want to look at that startle reflex. We want to be able to process our body and space appropriately. But then we also want to have that coordination. We want to have those connections in our left and our right hemispheres driving forward so that our brain is communicating effectively, and then we're reacting appropriately.
Let's discuss this further. The calming system in our body is of vital importance. This is what is known as our parasympathetic nervous system. So this is helping us slow down our breathing and slowing down our heart rate, especially when that anxiety sets in. This will help us keep us calm and relaxed. And the more we work on this, the stronger it will definitely become. This is important because this helps us notice the differences when we're just having those different emotions, whether it's anger, frustration, that impulsivity, or the fight or flight instinct, just being able to know how to handle each situation.
Yes. So it's like having two sides of a different coin. So there's your relaxed and calm state, and then you have our fight or flight response. So what we want is to be in that relaxed and calm state, right? We want that to be our dominant stage of every day. And of course, it's not always going to be possible, but the goal is to be 99% of the time. Being in your relaxed and calm state, it allows us to think and to act rationally, to act calmly. It allows us to have great deep sleep and to have a healthy digestion. And the system will mature along with our development. And if we're in our fight or flight response, this is accessed during times of extreme fear, anger, or stress. It's a survival mechanism to get away from danger. There's less energy in the body, and then that energy will shift onto the muscles, and they might, will run off. And there's just no rational thought. You're in complete survival mode. So being relaxed and calm, it keeps us from making these rash, irresponsible decisions. So our goal is to be able to emotionally regulate our thoughts and our emotions.
So I want to kind of touch more on that fight or flight response. Essentially, when we have a hypersensitive fight or flight and we're getting kicked over into that state, our limbic system takes over. And this is our emotional pieces. And we shut down those logical thinking skills. So as a parent, as an adult, how do you rationalize with a student or with a child that's launched into that and they're not making sense of it? Biggest piece, we as adults have to stop. We have to take a breath. We have to regroup ourselves, because you cannot fight emotion with emotion. You can't fight with the common saying, fire with fire. It doesn't work. So overall, what is that fight or flight look like? It looks like a student who's functioning in the moment. It looks like a survival mode, kicking, screaming, or even a complete just withdrawal and shut down. It's that emotional part of the brain being activated. So attention, focus, you raising your voice and saying, look at me, this is not okay, we're not doing this behavior, isn't going to work. It's not the time to try to have a full-on discussion and try to pull logic in and say, well, I don't want you to act this way. This isn't how we act because we're at the store, because we're at home. It's not going to make sense. It's not going to make sense for that student in the moment. It's not the time to punish or even try to discipline, because as soon as they get out of their fight or flight state, which can take 20 minutes, it can take upwards of 45 minutes to an hour, they're not going to recall even everything they said or everything they did in those moments, because their processing is shut off because they're only acting on emotion. However, this is the time to just be with your child. I'm a really big advocate of dim the lights, put some classical music on, wake up our senses using essential oils if you choose to use those, but don't try to have a conversation. Model calmness. Wait for them to slow their heart rate down. Wait for them to catch that breath of fresh air. And then we can walk them through how we need to work through this next time. Because in the moment, and I know it's hard to do, it's easier to sit here and say what we need to do and then go home and actually act on it. But what we need to do is model what we want them to do. If we're acting on emotion, all our student is going to do is act on emotion. When we have that teachable brain, when we have that balance and that calm, that's the time to show them exactly what we need from them and work through those pieces. The chaos is not the time to try to work through it.
Okay, so here are a couple tips on how we can handle the anxiety that our kids go through. So knowledge is power. So when we know what the trigger is that's causing them to have anxiety, we can then work on preventing or growing through that trigger. And so this reminds me of a 7-year-old we worked with at the center. So one of the issues or challenges her mother would have with her was just every single morning on the way to school, she would just have this major meltdown, and she just couldn't understand why. You know, she tried to do all she can, feed her breakfast, get her kind of ready for the day. But when it came down to it, she started realizing that she was having trouble tying her shoelaces. And I know that sounds really simple, but we worked on those fine motor control. And when she was actually able to tie her shoes, she felt really like she was part of her peer group. So pretty much they would always kind of pick on her because she didn't know how to tie her shoes. But once we kind of got that motor control down and helped her with tying her shoes, just that little feat, that actually helped with her morning routine with her mother and her dad. So that gave her the confidence in herself and in her skills, and kind of working it from there.
And I think that kind of goes back to what we were mentioning earlier, Mimi, is like, it can be, in our opinion, something so small, but at the end of the day, if we're already struggling with certain functions on a day-to-day basis, the last thing we want to think about is, I'm going to go to school today and my shoes are going to come untied and little Johnny's going to make fun of me and I'm not going to fit in. And so, and I remember exactly which kiddo you're talking about. Her thought process every single morning, that poor girl, was, I don't want to go to school because they're going to make fun of me and I don't have friends. And at the end of the day, it was something as small as, let's work on tying your shoes. And I'm not saying everybody's is going to be something small like that, but understanding what that trigger is, what is launching that kiddo into that fight or flight state where that anxiety and that repetitive thought process is just going off, can help us when we're breaking it down and saying, okay, until we work on the skill, let's avoid this. Or let's address it at home. Let's start growing through this, pull it together so that we're not seeing these issues anymore.
So tip number 2 is we want to get as active as possible. We want to engage the entire body and the brain, and that's the body movement, coordination, and timing. So there's a lot of different exercises that we recommend to use for all these different movements. So for balance, you can jump on the trampoline, ride a scooter or a bike, or use some rollerblades to roll around on the street. For movement, you can use twister, hopscotch, or even just simple running. Coordination, there's swimming, playing catch, going rock climbing. Timing, you have basketball, hula hoop, and dancing. And eye movements, you have mazes, as well as hitting a baseball. These are just some of the many different activities we can use in our day-to-day lives where they're anxiety reducing movements that help us bring that down.
And the last piece, and I know I touched on it earlier, the biggest tip I can offer you guys is be aware of your actions. As an adult, as a parent, be aware of how your child may be perceiving your actions. And this can be the tone of your voice. If you are waking up your kiddo in the morning and you're really loud, and you know most days they have a hard time getting up and getting ready for school or getting ready for virtual learning, they may be perceiving that tone of voice. Even though you might be coming in excited, they may be perceiving that, and it's triggering that fight or flight response, because if that morose startle reflex is present, they're already super sensitive to the loud noises. And so taking a step back and saying, okay, what does my face look like? What does my tone of voice sound like? How close am I to my student right now? Do they need me to kind of hold their hand or coddle them a little bit more? What works for your child? Because that's going to be very different across the board. But take a step back, look at how they could be perceiving you, and then find your calm in that chaos when your child is having a hard time, and help them through that as soon as we get to that place of calm. Another piece I want to mention, and I know we typically bring up a lot of these areas in most of our webinars, but we all have a tipping point. And when I was creating this webinar, I put on this ledge because I know that if I don't get a lot of sleep, or if I'm hungry, or if I spend a lot of time on my computer or my phone, or if I'm just out of my routine of exercise, or if I'm not prepared, I'm already really, really close to my breaking point. And one small little thing is going to set me off. And our kids aren't any different. They have the same emotions that we do as adults. They just don't have all the tools developed to handle them. And so ensuring that we're assessing all of those pieces. Okay, are we incorporating exercise, daily exercise, into our routine as well as our kiddos' routine? Are we getting an adequate amount of sleep? What does our nutrition look like? If we're putting junk in, we're going to get junk out. So evaluating all of these different pieces and factoring them in when we're coming up with that plan of action for our kiddo is going to make a big difference. And the more consistent we can be, the more consistent our kiddo is going to be. And I also want to mention our program here at Brain Balance, we do have dietitians on board. We have our nutritionists. That is not my background at all. But our head dietitian, Holly Larson, she does recommend additional supplements. There's a lot of research out there. There's a lot of different kinds of supplements out there. But typically a lot of my parents will ask, you know, what do you think about this one? Or what do you think about this multivitamin? The biggest thing I can say is what works for one person may not work for the next. And so figuring that out is very difficult, and I would definitely recommend that you guys talk to your pediatrician or talk to your general practitioner as far as figuring out exactly what's going to work for your kiddo. But some things that we do recommend looking into are going to be CBD oil, magnesium, calcium, probiotics, prebiotics, all of those different pieces. But once again, like I said, that is not my background at all. These are just additional considerations to take into account. Another big part, the more our brain matures, the better we're going to be able to tolerate sensory input, the better we're going to be able to control our body. We're going to be able to inhibit those actions or reactions. We're going to be able to keep it together when we're feeling anxious. But we're also going to be able to transition past the worry and the upset. The immature brain, when we have that disconnect that I was mentioning earlier between the left and the right hemispheres, that immature, underdeveloped brain, it's just going to react. And it's not going to regulate. The mature brain is going to tell you to stop worrying. It's going to tell you to stop overthinking. It's going to push you through saying, you know what, you can do this. It's not as big as we're thinking it is. The mature brain is going to have that control. And that takes us back to looking at those primitive reflexes, assessing our daily routine with coordination, rhythm and timing, and exercise, and then looking at those higher level skills and saying, what is going on? What is the trigger? And now how do we work through that trigger? I mentioned earlier, I am going to be sending you guys an email tonight with a link to the recording, but also just to a guide. And I can't emphasize it enough. Putting a plan in place to help you and to help your child succeed, not just, today or not tomorrow, but for the rest of their lives. Setting that up for years to come is going to be key. And I really appreciate everybody attending tonight. I appreciate everybody registering for our event. The reason we get to reach out to you guys is just because we enjoy helping families. We want to work with our community. And so giving back as much as we can is really key for us. If you have any questions, this is definitely the time for us to do our Q&A. I did ask you guys to send those to Mimi privately. So Mimi, if you don't mind reading any of the questions, if we have any out, or if you want to unmute yourself and ask a specific question, we can definitely answer it.
Yes, definitely. If you have any questions, we're here to answer it. And I will leave it open for you guys. Currently, I don't have any questions. Maybe if you guys want to share any tips or experiences you guys have had to actually encounter and deal with, that'd be awesome too. Maybe other parents may have some great insight on anxiety as well.
I have a question. My name's Elizabeth.
Hi, Elizabeth, go ahead.
So I heard you say about when our kiddo is having a difficult time regulating their emotions, you can't fan the flames type of thing, right? Like you can't fight emotion with emotion, I think is what you said to it. So I have two kiddos. So when one is having a difficult time like that, would it be appropriate to send them to their room and sit with them in there so as not to upset the other one kind of thing?
Definitely. I love having like a very designated area, like a calm down area, but I don't like using that for punishment. So making sure that line is very, very defined and clear. I want you to go to your room because I want you to calm down. I'm going to go sit with you unless you want to sit by yourself. But you're not in trouble. Once you calm down, you're free to come out. Because I feel like a lot of times our kiddos don't know where their safe place is. And so when we do have that designated area, I think that's great. I would really, really recommend that, whether it's their bedroom, whether it's a corner in the living room, have them pick it out. But do have it somewhere where it's separate. They're going to be safe, and they can calm down quietly.
Right. I guess with my daughter, my concern was I don't want her to feel shame, like that it's bad thing that she's showing emotion kind of thing.
Because there's nothing wrong with feeling emotions. There's nothing wrong with it, but we want to make sure that the way we're reacting is appropriate. And so I love that you don't want her to feel that way. And you know, typically what we do start to see with some siblings is one of them will start modeling that behavior because the other one is getting the attention, whether it's positive or negative behaviors, but we want to manage those appropriately. So I definitely think having that safe zone, that cool down place is really great for her.
Thank you.
Of course. Any other questions, guys?
I have another one.
Oh, that's fine, Elizabeth.
Go for it.
I don't want to monopolize the chat if someone else has a question.
No, that's perfect.
My other question is, I have a friend of mine whose daughter has super high anxiety as well. So this is actually more for that. She had seen a therapist and I guess she felt like it wasn't really working. So I guess my question is, there are measurable coping strategies, yes, that therapists can teach kids to manage, right?
Yes. And that's why at the beginning of this webinar, I mentioned anxiety it's so complex. And so any time we have a student in our program and they're going through anxiety or any kind of real mental health concern, I always want to partner our program with a counselor, with a therapist, or whatever the family is choosing, whether that's the medical pathway or not. And I say that because in the moment, and our program is a process, and I don't know if you've done any research on that, but we don't flip a switch and see immediate changes in one day. It's a process. And so we do need coping skills. We need those techniques in place because the emotions aren't going away. And so when we're driving forward those connections in the brain, having those measurable goals, those skills that a therapist or a counselor can teach a student or teach a mom or a dad or a guardian how to implement are very, very important. And sometimes it can be as simple as a breathing technique, or like the cool down space or the cool zone. Or I know one therapist in this area, and she uses, she calls it the red zone. And so she just wants the kiddos to say, I'm in my red zone. And then at least everybody is able to acknowledge those feelings. And that's the coping strategy that she uses. But yes, those are huge. I definitely recommend them. Very, very important. And they're really life skills. I can't tell you how many times I catch myself saying, and a deep breath when I'm feeling stressed out or overwhelmed. So it's not just to compensate in the moment. It's really to help bridge through those skills later on in life.
That makes sense. Thank you.
Definitely. And then I had Krista send a message. I'm not sure if she sent it privately or to everybody. But biggest piece with the safe place versus you're in trouble, go to your room. We want our kiddos to feel their emotions and kind of like what Elizabeth was saying, you don't want to shame them. Emotions are perfectly normal. We all have them. And so letting them know that it's okay to feel this way, but let's work through how we should respond to it. Is really key. And so setting up that designated, you're in trouble, and so now we're going to have like maybe a timeout chair or a timeout designated area versus you need to calm down. You're not in trouble yet, but go to your room and calm down. I think those are important. Okay, guys, we have time for one more question if anybody has one. Last thing, I'm guessing nobody else has a question. Thank you so much for tuning in tonight. I am going to send the guide to you guys tonight. I will send the link to the recording of this webinar tonight. If you have any questions about our program, I would love to answer them. We are open to the community. We are booking assessments. So if you have questions about development with your kiddo, definitely reach out to us. We'd love to get that set up for you. We'd love to just figure out some answers and come up with an action plan for you guys. Once again, thank you so much for tuning in. Mimi and Brian, thank you also for spending your evening with us. Really appreciate it, guys. I hope everybody has a wonderful Thanksgiving, and just a wonderful holiday season overall. Thank you.
Yes.